Everyone, welcome back to today's monthly talk with an expert. So for this month of May, I have the great pleasure to bring to this studio, my online studio, Emma Brockwell, a very known physiotherapist, a physiotherapist that I admire lots and I follow her work. And I'm very happy to have her here because today we'll be talking about motherhood myths. So all about pregnancy, childbirth, postpartum, all the things that we don't get told and we should know before. Hello everyone that's connecting in and joining the talk. Hope you're all well. Let's see if I can get Emma to join. There we go. Hello, Emma.
Hi, Vivian. How are you?
Hi, nice to meet you online.
Online. Lovely to finally meet you. And thank you so much for having me. I'm really excited to talk to you.
My pleasure, the same. I'm very excited too after following for so long, recommending you to so many of my pre and postnatal clients. I'm so happy to have you here and have the honor to speak to you and also learn from you as well. So it's going to be, I think, a very interesting hour. How's everything going? All good for you as well?
All good. I was a little worried that you might ask me to do this in Spanish. I did leave a message going, I just realised I don't speak any other language, shamefully. It's very British of me. So thankfully you're in English, so that's good. Yes. So now that I know that, I'm good.
I speak both languages and teach in both languages, so I'm more than used to having interviews every month with experts from different countries and different languages. No, nothing to worry about.
Amazing.
Good. So just like I was saying before, I was introducing you a little bit. So I was just telling everyone what the topic is going to be about. We're going to be talking about motherhood myths, so all those things that we get told which then are not reality, and the other way around, things that we never get told and we should get told as well. All about pregnancy, childbirth and postpartum. So before we get started, I just wanted to let everyone know that most of the questions I'll be asking Emma are things I'm asked from like my followers, things that my clients ask me as well in Pilates pre and postnatal. So just for those of you that don't know me, I'm a Pilates instructor and I teach lots of Pilates to ladies who are pregnant and also in their postpartum period, apart from obviously all the other types of Pilates machines, etc. So all the stuff that Emma's going to be sharing with us today is going to be interesting for me as an instructor, because I obviously have a great part in the progress that they do during those stages of the life, but also I'll be learning myself as well from Emma. So if you have any questions throughout the talk, feel free to leave them as well in the comments, apart from those that I'll be asking myself. And we're just going to go deep into it. I'm going to let Emma introduce herself, because I know she's a physiotherapist specialized in pelvic health, and I've read loads of the things that she does, but I want her to let you know what she does and where.
Well, I'm feeling the pressure. So as you say, I'm a pelvic health physiotherapist. I'm based in Guildford, but also in a place called Godstone, which is in Surrey. So I have 2 little clinics in those places. And alongside that, I also do quite a lot of, I guess, consultancy work, some, writing and just trying to get the word out there about pelvic health, really. My passion is really working predominantly around the perinatal period, and I really like working with my really sporty ladies, but honestly I treat any woman of any age, of any sporting ability, but that's just where my passion lies. My most important job, I'm a mum. So I'm a mum to 2 children who are, oh my goodness, 9 and 6, and I don't know how I forgot that. And I have a stepdaughter who's 13. And so, life is very busy. Life seems to be very busy since COVID, or the anxiety around COVID is lessened. Life is just very busy. So it's all very good and all very exciting. But my passion is to spread the word about pelvic health. So hopefully I do that via my social media and through other resources that I share.
Yeah, and I've read some of the stuff that you've been publishing, articles and so on, but about spreading the words, I think that the jewel of your crown is precisely this book, which I've got with me. So why did no one tell me? I discovered this book through your profile, obviously, a while back. And when I read about it, I was like, oh my God, this is a book that every woman needs, because whilst I'm teaching, I get so many questions from my clients as well, asking about topics that they don't know. And obviously for us working in the industry, it's so obvious, it's like so basic stuff, but they don't get told from the midwives, the gynecologists, like nobody informs women. So I just feel this book is very empowering. So if you are a mum or a mum to be, this is a great book to have. I've been reading it because I just recently received it, and it's so useful because it goes into depth, but also at the same time it's so easy to understand the way you've written everything and explained everything. So I personally feel that for those women that have lots of different questions during, after pregnancy, they don't know where to get the answers from. Internet sometimes doesn't give you the right answers as well. This is like a great place to go to, because women suffer a lot in silence as well. They go through lots of things that they don't understand. They just normalize. They think it's normal. For example, I know pain during sex, or a bulge in the vagina, incontinence, it can be anything. And they just normalize it. They think it's part of the process of being pregnant or in postpartum, when it should not. So reading this during your pregnancy will answer lots of questions, and will also highlight what should not be happening in postpartum, so that if it does happen, that you know, okay, I have to do something about it. And from my side, because obviously I teach Pilates, I found it very useful because it's full of functional movements and exercises for the ladies to do when they're not even joining a class. Obviously with an instructor, it's much better because you'll receive a program designed for you with your modifications, but at least you get like the very basics, which I think is very, very valuable. So from that side, congratulations to you, Emma, and for those that are watching us, it's a very informative and empowering book, so make sure you grab a copy, and we're going to get into it now, because the book, obviously when I've been reading it, I've had lots of things and pop up into my head, and obviously things that I also share with my clients, and many of them have asked questions about stuff that are in the book. In fact, the answers are in the book, but we'll try and just give them a bit of the basic answers to many things. So starting with pregnancy, the big topic of all those motherhood sections that we're going to be touching upon today. Emma, if you could explain, because that's something they've asked me a lot, what are the physical changes that happen during pregnancy? I think those are the obvious ones, but the non-obvious ones are, what are the psychological and hormonal changes, the ones that we don't see, that happen in a woman's body?
Yeah, I mean, I think during pregnancy, every part of us changes. So on the outside and on the inside, you see changes. And one of the really crazy things about pregnancy is these things happen really, really quickly. So, you know, your first couple of weeks of pregnancy, everything doesn't seem to have changed much. And then all of a sudden, you start noticing things like your hair getting thicker and stronger, your nails as well. So those simple, you know, nice changes, I think, that women experience. But your skin can change. So some women report that their skin changes are positive. Some women report that they get maybe an increase in acne. It just depends on what your hormones are doing, really. So no one woman is the same. And you touched on that a minute ago when you said that about the book. You know, the book is for everyone, but in an ideal world, we'd all see a pelvic health physiotherapist during pregnancy and after pregnancy, and as you say, have a fitness professional to really guide pregnancy and postnatal recovery as well. And the same goes with your pregnancy changes. Your posture changes quite significantly as your bump grows. And all the muscles around your body change as well, again, because of the hormonal influences. So the big key muscles that change, of course, are your abdominal wall. That gets quite a lot bigger, and it's meant to. And what women will find is that their six-pack muscles, so their rectus abdominis, starts separating, or the linea alba that connects the tissues together starts separating, and this creates something called a diastasis. It's a perfectly normal part of pregnancy, and one that we really need to explain to women should be happening. Otherwise, baby can't grow. I'm sure we'll touch back on diastasis at some point in a moment. Your bottom changes, everything, all your muscles lengthen. They can become a little weaker in the process as well. So that's why it's really important that you're exercising, doing amazing exercise like Pilates or running, But exercise, being physically active is really important during pregnancy because of all these changes. You get a lot more blood around the whole of your body. You end up, your breathing changes. Obviously, as baby grows, your ability to breathe becomes a little bit harder. You start becoming a bit more breathless as bump grows, but that can also happen in first trimester as well. And that's simply hormonal effects that are occurring. So it's quite phenomenal what's happening inside and outside. And of course, I guess one of the biggest changes that we make women aware of are the pelvic floor changes, or their pelvic health changes. So your pelvic floor will, of course, because you're pregnant, be lengthened, because obviously you're holding a big weight, and it will, if you don't think about exercising that muscle, it will start to become a little bit weaker. So that I always highlight is a big pregnancy change, because often women will think that if they don't have a vaginal delivery and only end up having a C-section, that they won't have any pelvic floor issues occurring. And I wish that were the case, but that's just not the case. You can absolutely experience pelvic floor dysfunction during and after pregnancy, no matter how you deliver baby. And then if we think about even your musculoskeletal changes, so your feet will change, your ligaments in your feet will soften and change. And actually, when I had my babies, my first baby, one of my foot grew an extra half a size, and those changes, they don't go back, because that's just one of those quirks of pregnancy that stays with you. But for the most women, the changes that happen during pregnancy, once you've had your baby, generally all go back to normal. But I don't know, pregnancy is just one of those times where you realize how incredible women are, and just what amazing things their body can do. But you've got to think of it as a systematic, a whole body change. Mentally, physically, it's all happening, and it's all happening to every one of us out there, but it will happen differently to each of us. And it's really important that if you're struggling with any of those changes, that you speak to your midwife, your GP, or pelvic health physios, or even your fitness professionals, because you guys are on the front line. So you guys are likely to see women all the time that are complaining of these concerns, and reassure them that most of them are normal, but if there are any symptoms that are occurring because of these changes, that you can see certain medical or health professionals to help support you with those changes.
Yeah, absolutely. Yeah, I sometimes feel that I do like the job of the midwife, the physio and everything. So they ask me questions as if we had all the answers, because it's the only people they're seeing who like related to pre and postnatal world. And I mean, I have done training with midwives, so like I know what work they do with women and so on. So all the training I've done with them has been really helpful for me to be able to help them with the concerns they've got. But obviously I always refer them to the right person. And sometimes they don't even know what a women's health physio is. And when I tell them the importance of visiting one, it's like, oh, really? Do I have to do that? And it's like, yeah, of course. I mean, I can't cover that part. It's not, don't expect me to do it. So yeah, sometimes the amount of like unknown stuff that there is around this is very high. Yeah, you're right. I mean, often it's the first time that someone will have heard of a women's health or pelvic health physio. And you know, there are some professions within medicine that aren't even familiar with what we do. So we have to be better as a profession at really, you know, shouting from the rooftops about what we do. But we also have to work collaboratively with fitness professionals, coaches, medical professionals, to really make sure that a woman's getting a holistic approach to their pregnancy. And, you know, not one person has all the answers. That's just impossible. So, you know, women need to reach out and know that there's lots of professionals out there that can support them. Yeah, absolutely. Yeah. So with regards to what we were talking about before, about the hormonal changes and physical changes, there was a lot of usual questions about the importance of exercising during pregnancy, some women being afraid of maybe hurting the baby if they do that. But you do explain it in your book. It's very important to train your core. And in Pilates, we, I think, have a very big role in that, so that it does happen, and it does happen correctly as well. So it's important when someone becomes pregnant that they go to prenatal Pilates or prenatal kind of fitness, never to what they used to do before. And there's a big part with regards to what you were saying regarding hormones and so on. Relaxing, I think, plays a big part as well. The amount of work that I see that we have to do in order to stabilize the joints and so on, because they tell me I feel very wobbly, very unstable, like I don't rely on my body sometimes. So I just wanted to ask you about the importance of doing exercise. Why is it that it's so crucial that women, when they're pregnant, they do exercise?
Yeah, so I just want to come back to that hormone thing, because we've come away from that now. So we now know that yes, absolutely, relaxin is a key hormone that absolutely at certain stages makes things a little bit softer in our pregnancy. But for a long time, we used to think that pelvic girdle pain happened because of hormonal changes, softening the joints, making some women's joints unstable. Well, we've got so much really amazing evidence to prove that that's not the case anymore. So we know that actually women's pelvis, which I often worry about becoming unstable during pregnancy, is actually a really stable joint, and the joints don't come out of place, and they don't certainly they're not certainly influenced by hormones in that way. But the pelvis is quite a sensitive structure, and when we're pregnant, sometimes women are quite anxious about those changes, and that can feed into a system that creates a bit of oversensitivity in the pelvis, and as a result of that can cause some pain in the pelvis. So we used to think, well, let's stabilize you, let's strengthen you up, and that will give you more stability and reduce your symptoms, often in pelvic girdle pain. But we now know that that's not the case. What we're actually trying to do is create some element of novel movement. We're trying to create some element of empowerment, I guess, by encouraging women to think about strengthening that area. And Pilates is a really good way of doing that. It's a great way of women becoming mindful and just switching their system down, because pregnancy is quite unnerving, actually. You suddenly see all these changes happening, and you think, oh my goodness, how am I going to cope with these changes? And sometimes exercise is a really, really helpful way in calming your system down. So that's one of the ways that exercise is really important. It can calm your system down, and everyone's very busy nowadays, so it's really important that we do that. Obviously, as you've touched on, it's important that we're strengthening. The guidelines that are out there, so if you check out the anyone watching, the Chief Medical Officer guidelines on physical activity, so they're for the UK, and they quite clearly state that women should be exercising or being physically active. So that could just be walking up the stairs as opposed to getting the lift, for at least 30 minutes a day. And we know that if you are physically active or exercising, then you will see such huge benefits during your pregnancy. You'll be stronger, and you're about to prepare for a pretty big thing, motherhood. You've got to be strong for motherhood. You're also going to lengthen and strengthen all of those muscles that are changing dramatically with those physical changes. And it's also a time to really sort of focus in on yourself, because not enough of us do that. So I think exercise is really important, just to find you as well when it's changing as dramatically as it is during pregnancy.
Yeah, absolutely. Prioritizing themselves. I think it's something that we don't do as much, especially women. We always focus on work, the kids and family and partner and and we forget about ourselves. And I always keep reminding them, make sure you are a priority. Even when you give birth, you have to dedicate some time to yourself. So absolutely, it's
so important. But obviously exercise is preparing you for childbirth, whether you have a C-section or a vaginal delivery. And we've done some research that really shows that if you're stronger and maintain your exercise during pregnancy, you are likely to have an easier postnatal recovery. So really, there are very few limits or contraindications around women and exercise during pregnancy. You should always be led by your, sorry, I've got a sore throat, by your medical provider. But fundamentally, if you're having a low-risk pregnancy, you can do any exercise you want. You can even start a new type of exercise that you've never done before, so long as you gradually, slowly build your way into it, and so long as you enjoy it. And the physical and mental health benefits are just massive. But they're not just good for you. Exercise is also good for your baby as well. So the benefits it brings for baby are huge. It can absolutely reduce their chances of diabetes or obesity later in life. Often babies are smaller if you're exercising, which is better for you through delivery and for baby's health later in life. So the benefits for you and baby are massive. And I know there's this big concern still around women, and I shouldn't exercise when I'm pregnant. It's quite the opposite, actually. It helps reduce your risk of preeclampsia, diabetes. It's massive as to the benefits that it can do. So if you don't feel confident or comfortable, check out the Chief Medical Officer's infographic, check out the Canadian pregnancy exercise guidelines, because they're great too. And if you want to, you can take them along to your midwife or your instructor or your physio or your doctor and just talk them through with you. But always listen to your body, always feel comfortable with what you're doing. And yes, you might need to adapt what you're doing throughout your pregnancy, but I would strongly encourage women to be physically active and exercise during their pregnancy. It's really important.
Absolutely. And I see it a lot as well, that it's such a great way to avoid or relieve any aches and pains that they get during pregnancy.
Yes.
Because the fact
100%.
that you're strong, that you're strengthening, for example, your back muscles, which because of the weight of your breasts and so on, because they're preparing for you to breastfeed, you start hunching slowly, and also your lower back curve, it's more accentuated because of the baby pushing forward as well. So there's so many things, so many changes in your body that you have to keep moving and strengthening. And also for afterwards, we'll talk about it as well, but for postpartum, if you have a strong back and you have good posture and so on, it's just going to avoid so many of the usual pains that you get because you're hunched forwards breastfeeding the baby and so on. So it makes a massive difference. I personally, amongst all the clients I've taught, I've never had a client doing Pilates during prenatal period, so pregnancy and postnatal, that has complained of a severe pain. They have like the aches and pains sometimes, which get alleviated after the hour of class that they do, but I've never been told, oh, I have this horrible pain like stuck to my back the whole time. So I think that it's definitely, in my classes, like it's like proven that it does do it. Like Pilates strengthens you and keeps you active and energized and mobile, and it just avoids all the stuff that tends to happen to women who do not exercise. I see it so much, like when I compare women who do and don't exercise. So absolutely, it's a very, very big part. I totally agree. Regards to, go ahead.
Oh no, I was just going to say the only other thing it does as well is it helps you sleep. When you exercise, you sleep better, and actually we don't get enough sleep really generally as a population in this country, and when you're pregnant, sleep becomes a bit more difficult. So it does definitely help you sleep, and that is brilliant for you and baby throughout and then after baby pregnancy as well.
Yeah, absolutely. And with regards to what you mentioned before about your prenatal checks and so on, how important is it as well, Emma? Because so many women don't know that they should be going to women's health physio whilst pregnancy, not just in postpartum, but whilst pregnancy. And some don't know about the perineal massages and all the stuff that should be happening in preparation for giving birth. So why is it so important that they go and check themselves with someone like you?
Yeah, it's just hugely advantageous. If you think pregnancy's the time when you can kind of prepare yourself for some changes that are definitely going to happen, okay? So often when you injure yourself, you're not prepared for that. So you can't prepare your body for an injury always. Whereas in pregnancy, you can prepare yourself for, let's be honest, a little bit of injury vaginally, or if you have a C-section, major abdominal surgery. And so therefore your postpartum recovery is just going to be so much better. So we often will help with that. We'll talk to you about the right exercise that you might want to choose. We'll talk to you about addressing certain areas that on assessment look a little bit weaker or need a little bit of help. Pelvic floor dysfunction is one of the big things that always flags up in pregnancy. If you've had a pelvic floor that perhaps you've never paid much attention to, because let's be honest, we're not educated to do that, and that needs to change. But if you have a pelvic floor, a weak pelvic floor, you might start experiencing symptoms of urinary incontinence or heaviness in the vagina or even fecal incontinence. And if that's happening in pregnancy, unfortunately, that is likely to happen postpartum as well. And as you've touched on, these aren't things that you should live with at all. These are things that are very treatable. And even in pregnancy, we can treat them. So we can screen you. And that's what I think, instructors like yourself are really good at doing. You're screening prenatally to say, have you got any signs of pelvic floor dysfunction? but we are also seeing women who don't see people like yourself, and therefore we screen them and check they have no signs of pelvic floor dysfunction. But even if they don't, we're going to talk to them about how to prepare your pelvic floor for pregnancy and childbirth and postpartum recovery. So yes, as you've touched on, we'll talk about how to strengthen the pelvic floor, perineal massage. That's just really stretching the perineal tissue. So if you have a vaginal delivery, it better prepares you for childbirth, but also is likely to reduce how much you tear during your pregnancy as well, because 85% of women who have a vaginal delivery will experience an element of tearing. And I'm not saying that to scare anyone, but that is a reality. It's a small hole that then is stretched 250 times. It's likely to be grazed, stretched, slightly torn on your first birth, with your first birth. So if we can help reduce the amount of tearing that occurs, and that's gold. That's amazing. And then obviously we want to help you, educate you around what to expect during and after pregnancy as well. So it's just a really awesome opportunity to prepare yourself in as best way as possible. The biggest problem is it's not something that's offered on the NHS, and not everyone can afford to see someone like me. So there's a disparity there. And really, in truth, the research is starting to show now that women who experience pelvic floor trauma during childbirth, they're likely to recover much better postnatally if they are training at their pelvic floor, if they understand that these changes will happen. So it's all about education, and that's kind of the title of the book. Why did no one tell me? I'm not really sure why people aren't being told this stuff, because it's your body. You need to know that these changes are going to happen so that you feel empowered and know best how to prevent and manage them. So that's why I would love for every woman to see someone like me prenatally. So we just have to keep pushing for it, and maybe it will happen on the NHS eventually.
Yeah, absolutely. I just find that I think with everyone I've really taught in pre and postnatal, I think maybe 1-2 women have told me ever that they had already gone or they knew what a women's health physio was, but the rest nobody knew. And it's just this lack of education. And also it's the fact that I think the health system, not just in the UK, but Spain, many other countries, because my clients, I have an online studio, run an online studio. So my clients are in different countries around the world. Some countries, they don't even have women's health physio. It's not a thing. And in the countries that they do, the midwives, the gynecologists, they're just so saturated that they just treat patients as a number. You're just one more person I see, 5-10 minutes, and you have to go. They don't stop and educate you and tell you about what you should do, not should do, who you should visit. It's just so disgraceful, because it is, that when I find that I have a woman who has no idea about anything, what's the pelvic floor like, very basic stuff about the body, it's very shocking. And then I feel like I have to educate them when, I'm a Pilates instructor, but I'm not a women's health physio, I'm not a gynecologist, I'm just trying to give you that information that you don't have. But someone else should be giving you this as well, which is really what I think their role to do. So yeah, it's very frustrating when you see that, because some of them, I've got some clients who've had, for example, incontinence whilst pregnancy, thinking it was absolutely normal. And then because I told them to go to women's health physio and they got treated during pregnancy, whilst after they gave birth, they were perfectly fine. Incontinence had gone over, it was finished, it was great, which could have been even worse if they hadn't gone and nobody had told them that this is not normal, you should not be peeing on yourself. Or other cases of women who had never checked the pelvic floor and then realized when they went to women's health physio during pregnancy that they had hypertonicity, and thanks to going, then they flexibilized the muscles, the tissues, and then everything was great during postpartum. But some women just have no clue about these things. They just think, oh, I feel fine, nobody is telling me anything's wrong, I don't feel anything is wrong. So because they don't really have any kind of sensations in their pelvic floor, they just feel everything's fine. But the sensations we get are not what's happening down there, because it's very hard to exactly feel what's happening down there. I know it myself, because I've had pelvic floor issues. I'm still going to women's health physio, and I didn't know that what I felt was happening down there. They have no relation between what my brain felt and what was happening down there. I thought it was coming from somewhere else. And then just the more I knew, the more I educated myself. I was wow, all of this is happening there, and I had no clue. So even us instructors or physios, people who are in the industry, that we get to know our bodies better, more body aware, we still have those kinds of issues. So just imagine people
Oh
out
yeah.
there who have no clue. So yeah,
Yeah.
it's very frustrating, to be honest,
It
but
is. It is.
we have to
And
keep educating.
absolutely. And if you think the problem with the pelvic floor is you can't see it. So,
Yeah,
you know, you can stand in Pilates and beautifully demonstrate all the exercises you want women to do, but you can't, I hope, demonstrate pelvic floor exercises to them. So
yeah,
it's really hard. So you're basically then going from a piece of paper that's saying, squeeze your perineum and, you know, hope for the best. And that's fine. Some women do get that, but you'll actually find, again, the research shows that about 35% of women who read a written piece of paper on how to do pelvic floor exercises, they don't get it. So, so therefore, actually, verbal cues are better. So you give loads of verbal cues in Pilates, which I love, and lots of different variations as to how to squeeze your pelvic floor. But ideally, the best way to know that you're doing your pelvic floor exercises correctly is by having an internal vaginal assessment. Which, look, it's not glamorous, but it's you know, we have smears. It should be part of your general well-being, your general MOT, and keeping up, you know, your general health. So I think the more we talk about it, and I think you guys are so important, because there's not enough pelvic health physios to go around. So some of the education does come from you guys, and that's awesome, and it's brilliant that you are talking about it, because look at your lady who's now leak-free. She wouldn't be if you hadn't mentioned it. So it's really important that we're not just thinking it's only pelvic health physios that can give this message. It has to be all of us as a collective. We're all as important as each other.
Yeah, absolutely. Yeah. And with regards to what you were saying, with regards to pelvic floor and so on, in the classes, sometimes I get clients to say, oh, can't you tell me if I'm already engaging my muscles well? I was like, well, no, because I can't see them. It's the only really group of muscles that we can't see how they perform, because it's not like physically you contract, you lengthen the muscle, and through the skin, more or less, I can get like an idea. With your transverse abdominis, I can see how you're hugging the baby in and then releasing and so on. But pelvic floor, I don't know. Like, if you don't go and get checked, there's no way I'm going to know. So that's why I always make it compulsory. In my online studio, at least, not talking about anywhere else, but in my online studio, I make it compulsory for postnatal ladies when they return after giving birth to have checked themselves with a women's health physio. Let me know what she said, if they have a report and so on. I just want to read it, because knowing the state of your pelvic floor helps me teach you better. If I know that you have a weak pelvic floor, then we'll work certain things. If I know you're, for example, have hypertonicity, then I'll do something else. So it just helps me make the classes programmed and designed for your needs, because I otherwise I won't know. If you don't go and get checked, I'll just train you normally, not having a clue. And maybe what we're doing is worse. It can be better, but it can be worse as well. So for me, it's such an important thing that they go and get checked. And that's why I recommend you to so many of my clients. I recommend another women's health physio I know here in Twickenham. So I just give names out there to them, because for them it's like, oh, I have no idea where I should be going. It's like, well, here you go, names for you to know and try people. But yeah, it's such a big part. And I know it's not something usual out there. I know not every instructor out there gives like recommendations of things, but I try to like tell them about nutritionists and women's health physio and gynecologists, just like any people I know from around me, that I've collaborated with in some way or partnered with. I just try and like share it out, because at the end of the day, like you said before, it has to be multidisciplinary. We don't all know it all, so we can't give just every service in the world to that one person. So yeah, absolutely. Well, shall we move on to? Go ahead.
I said I love you that you do that. I think that's brilliant.
Thank you so much. Well, going ahead then for childbirth, because I think this is the heavy part. Obviously, lots of women that get to that point, I've discovered as well, they have no clue what's going to happen in labor. They don't know what the stages of labor are. They just think everyone has to be in bed when there's more options for you to choose whilst you're in labor. It can be in a squat position. It can be 4-point kneeling. You can just deliver in so many ways. And so many women just don't know this. So if you can tell us, Emma, a little bit about what happens in labor, more or less stages, because I know we can go in depth here for hours, but just briefly, and any complications that can happen. The different births that there are as well, and how can you heal from them, because they're very different as well.
Yeah, sure. So basically, if we're thinking about vaginal deliveries, it depends if you go into labour naturally, or if you are induced. Induction tends to take longer, if I'm honest, and that will often happen if you are over your due date and midwife, doctors, medical professionals have decided that you need a little bit of assistance for baby to come along. And that often then becomes more of a medicalized delivery, unfortunately. So you wouldn't be induced and be at home, you would have to be in hospital, but you can still be in the birthing suite for that to happen. And induction can happen in a variety of ways. But fundamentally, you are supported throughout that with the midwife team until it comes to a point where you have to then have a more hospitalized, medicalized delivery. And then with that delivery, if that happens, and you've gone through your latent labor and you're going into active labor, which is where the cervix is opened to about 10 centimeters. I'm not sure if my hands are quite that. Then obviously then you will be guided on pushing. But to be clear, you do not have to be lying down in the lithotomy position to experience this, to experience a vaginal childbirth. And I would encourage you not to be. I would encourage you to have as active a delivery as you possibly can. And you can actually have epidurals that are still active, so you can remain active whilst you have your epidural as well, if you decide to have an epidural. But as you say, the more you're moving, 4-point kneeling, side lying, squatting, all of those positions, if they feel comfortable for you, then you can be supported by your midwife to deliver your baby. And that can happen if you are induced or if you go into natural labour. Sometimes though, things don't quite go to plan vaginally, and let's say baby's struggling a little bit to come out, and maybe you've been pushing for quite some time, so you've been in active labour for more than 45 minutes, which is just about enough time to sort of need a little assistance. Then you should very much have a discussion with your medical provider and yourself, or your partner if you're not feeling free to advocate for yourself, as to whether or not potentially you have an episiotomy or you have an instrumental delivery. If you have an instrumental delivery, you will and should have an episiotomy, which is a little cut that they make around the perineum. And they do this just to help the instrument support baby as you're birthing. So they'll either use forceps or they'll use Ventouse. I personally would highly recommend, if you can in your birthing plan and during this time, unless it's absolutely an emergency and there's no other options, would highly recommend avoiding forceps if you can. They aren't the best instrument of choice, in my opinion, for mother. Now, I'm being very, mother-centric here. Obviously, if baby is an emergency and baby has to come out and forceps are the only way of that happening, then absolutely that has to happen. But if you have the choice, I would stick with the Ventouse if you can. The other option, of course, is if you have that choice and they say, well, you could have an instrumental delivery, you could have forceps, or you could have an emergency caesarean, then some women often will opt for an emergency caesarean because there's less trauma to the pelvic floor when that happens. But having a emergency caesarean is not an easy option either. It's major abdominal surgery, so you want to feel right in your mind that you're comfortable with the process. But personally, I would go with emergency C-section over forceps delivery. But obviously, I'm not an obstetrician, and I'm just giving you my perspective from a pelvic health physio perspective from the pelvic floor. Caesarean sections are, I think, highly underrated as to how difficult they are. So I personally have had an emergency caesarean and a planned caesarean because I couldn't deliver vaginally with my second. And the big thing with an emergency C-section you need to remember is you've just tried, like in my case, I tried to labour for 3 days. I didn't even get to the active labour. I didn't get to pushing. I don't think I dilated more than 4 centimetres. I was induced. It just didn't happen for me. I opted for an emergency C-section, but it is definitely a big deal. It's all hands on deck. There's a lot going on in the operating theatre. And I say this because it can be quite overwhelming when you suddenly are whisked into the operating theatre. And it's good to know that there's going to be lots and lots of people there, about 20, 25 people. And they're all going to be there to help you and help your baby. But they're cutting into 7 layers of abdominal tissue. So it's a really, really big deal. And the same goes with the planned caesarean as well, obviously. But there's preparation there. You know what to expect. And with my planned caesarean, I would say I recovered better simply because I knew what to expect. I had control. I like control. And so for me, that worked much better than having to then maybe go through another potential vaginal delivery and the risk of an emergency C-section. So I don't think either option is perfect at all. And birthing is beautiful. It is amazing. You can still have a C-section and hypnobirth and still have the music and still have the, you know, the environment that you want to a certain extent. But it is a much more medicalized way of having baby. But women have to really do some research around it, I think, to really feel comfortable with how they feel about it. It is your choice how to birth. But generally, if you have a lovely, normal vaginal delivery, I would say your recovery in general is a little bit quicker, but that's a generalization. Obviously, it's based on the individual, and you can have someone that delivered beautifully via vaginal delivery, and their recovery, excuse me, takes a lot longer than someone who's had a C-section. So it really varies. But I would say, you know, the more knowledge is power, and the more you read up about it, and the more you feel confident with the process, you will go in there feeling like you can advocate for yourself. And if you don't feel like you can advocate for yourself during that time, make sure you have a partner, a birthing partner with you who can, because a lot of it falls to them when you're in the zone. Particularly in the vaginal delivery. So that's a really, really, really very horribly brief overview of childbirth.
It makes perfect sense to me, and I completely agree. And I see it as well in women when they come back to postnatal classes, or they tell me the experiences they're recovering the few weeks after giving birth. In general, I found the same. Vaginal delivery allows you to have an easier and quicker recovery than C-section. But obviously, all that you've done previously in your pregnancy, if you've exercised during pregnancy and you've done everything, and like for example your prenatal checks with the women's health physio and so on, I've noticed that even if you have a C-section, all that stuff that you've done previously rewards you afterwards in postpartum. Absolutely.
It really does.
C-section is a very big surgery. Some women just take it as, oh, I'll just have C-section because it's easier, you know, I don't have to push or anything. But I always encourage women the same, to think about it, because it's not as easy as it sounds or looks. It's very hard, and psychologically for some of my clients, it's been very hard to see themselves that they can't get up and the sofa for themselves, or like lie into bed for themselves, like knowing that they're dependent on someone for a couple of weeks. For some of them was very hard. You
underestimate what your abdominal actually does. You're like, oh my God, it even does this. It even supports me. There's even simple things like coughing or sneezing or going for a poo. It really is quite uncomfortable. But the other thing to say is, obviously, if women have had, unfortunately, experienced a 3rd or a 4th degree tear, which is a much more significant tear from the vagina to the back passage, that recovery, well, not always, but often tends to be slower as well. And that's why things like perineal massage can be really effective. There's something called the OASI bundle that's been set up by the Royal College of Obstetrician and Gynecologists, and it's in certain hospitals. So, for example, the one nearest to me is Croydon Hospital, and that's where the midwife follows a set of protocols to help support the perineum when you're birthing, so that you can hopefully, please God, reduce the chances of a 3rd or 4th degree tear. So if you literally go onto the RCOG website and look up OASI, that's OASI package, I think, you can see, or bundle, OASI bundle, that's it. You can just see how, or even ask your midwife, can I make sure that that's part of my delivery process? They'll be familiar with it. It's becoming pretty bog standard, but we want to try and reduce the chances of 3rd or 4th degree tears, and in my opinion, reduce as many forceps deliveries. That would be really nice.
Yeah. And with regards to the vaginal birth that we were mentioning before as well, in Pilates, what I personally do, and this is not something instructors are trained to do when we do pre and postnatal training, but because of my training with midwives, I personally teach them at the last few months of their pregnancy, all the movements that they can do whilst they're having contractions, the positions they can get into if they want to have natural vaginal birth and so on. Because some women start with the idea, oh no, I'll be in bed, because that's all they know. And then as I start telling them about all the other possibilities and they start asking in the hospitals and so on, I start teaching them all the other ways of also giving birth. And some of them who had, for example, I've got a client in the first baby, she was in bed, had a horrible delivery. She had like a traumatized kind of experience. And then in the second one, the midwife didn't even tell her how she had to breathe. It was quite terrible in the sense that she didn't get any kind of support or anything from the medical practitioners. And with all the breathing that I taught her, the way that she had to be breathing, the movements she'd be doing, the positions she could get into, she gave birth not even noticing she was giving birth. When the head of the baby popped out, she thought she hadn't delivered yet, and then the midwife was like, oh, the baby is out already. So she was shocked, like, nobody told me what to do. I just followed what we did in class. I replicated everything from class, and it just happened.
I love that. I mean, that's brilliant.
Yeah, it doesn't mean that it does guarantee that. I mean, I'm no magician or anything, but just knowing how to breathe, how to engage the right muscles, the positions you can get into, just try that first, because maybe with a natural vaginal birth on the floor or squatting or whatever, you do it and it goes perfect. And if it doesn't, then obviously you always have the other options that you just mentioned before. So I always encourage women to go for like that natural kind of birth first.
Yeah, definitely. Absolutely. Yeah, the more movement we have, hopefully the more we can reduce perineal tears as well. So yeah, I love that. That's spot on.
Yeah. Well, just to go to the last parts then, for postpartum, we've already mentioned a lot of postpartum, to be honest, but if you can just let us know what are the common postnatal issues, because for example, I see things like incontinence, prolapses, diastasis, which you mentioned before, vaginal dryness, all of these things, and how can a women's health physio help you with that when you go to your postnatal checks?
Yeah, so if you are experiencing any of those symptoms, and obviously you want to prevent any of those symptoms occurring, then a pelvic health physiotherapist will scan you, assess you from head to toe globally to see what deficits there might be and what we need to do in addressing some, strengthening or lengthening of tissue. And then obviously, ideally, we would offer you a vaginal assessment as well. And that is an assessment of the whole perineum, the whole vulva area. So we're looking at the tissue quality. We're looking at any tears or scars around potentially the perineal area. We're looking at how well your pelvic floor contracts from the outside. And then obviously internally, using a digital assessment. There's no speculum involved, so it's nothing like a smear. It should be really quite a comfortable process, if you like. It shouldn't cause you any pain. We'll assess around the whole pelvic floor, look at how strong your pelvic floor is, if there's any tightness there, but also if there's any signs of pelvic organ descent. So if the back wall or the top wall of your vagina have descended a little, which is very common, particularly after having a vaginal delivery, but not exclusively to that, then we can assess that, and then we can start you on your own individualized, if you like, treatment regime. So we'll start you doing your pelvic floor exercises, although I'd encourage you to do those as soon as you've had a baby, because we wouldn't normally see you till you're about 6 weeks postnatal. But it's not just about pelvic floor work, it's about scar work. We'll obviously, I forgot, assess your tummy and assess any C-section scar as well. So we're generally looking at how things are. Things are likely to be injured. So then we look at how we can then rehabilitate you. So we'll look at getting you back to exercise soon. I would encourage you to start exercising as soon as you've had your baby, but sensibly. So I'm not going to suggest, obviously, that you go for a run on day one of having had your baby, but it might be quite nice to do some breathing exercises, some pelvic floor contractions and relaxations, some lovely stretches, some really simple mobility exercises, just to get your body back, rehabilitating slowly but surely. And I would encourage you not to wait until you've seen your GP at your 6-week check before you start doing any exercise. So get out, have a walk, little and often, but also to the extreme end, don't overdo it either, because of course there are some mums that are going to get back to it way too soon. And there is such a thing as the 4th trimester, that first 12 weeks, where you really need to rest and recover. And I think it's great on social media because we've got really good at saying, right, you can exercise sooner. And guess what? You can do lots of exercise leading up to getting back to high impact, but we suggest high impact happens later. However, I think we've forgotten to add that you also need to rest and recover as well, because that's just as important for your recovery. I'd argue maybe a little bit more so. I don't think postpartum women are resting enough, and you are literally having a baby and you're expected to be up all night lifting this heavy little bundle. So there's a lot to go on, and you need to think about your body as well, which is very hard when you've got a new baby and it's all quite consuming.
Yeah, absolutely. Yeah. At the end of the day, you just need to give time for your body to heal itself, because the human body is very smart. It can do it by itself. Lots of the parts that you need to heal will be done by itself. But you need to give the time and allow that to happen and not overdo. So yeah, absolutely. And with regards to all of that you were saying, I did see in your book that you do have like a table where you explain all the bits and bobs of exercise that you can be doing every week since you give birth. But when you come back to normal exercise, when you've been allowed by your midwife, physio, etc., something like postnatal Pilates, what do you think with regards to, it's something that I hear amongst women a lot, no, I won't be doing exercise because instead I'm going to be wearing an abdominal corset, band, waist trainer, whatever you want to call it. What do you think about replacing exercise and training your transverse abdominis and replacing it by one of those?
No. Yeah, I mean, I don't encourage any abdominal trainers, any abdominal corsets at all. Medical graded compression. So you've had a C-section and have a diastasis. Medical graded compression up to sort of just below the breasts, around your abdominal wall, is really effective at getting the lymphatic system moving and encouraging healing. That does quite a different thing to an abdominal trainer, which binds you. And it basically stops the whole core system maintaining its dynamic ability and its ability to be mobile. So if you suddenly stop it working, it's a bit like, do you remember we used to put people's necks in braces when they had a whiplash and then you couldn't move your neck? It's exactly the same thing. You need to be moving this muscle. You need to be strengthening this muscle. And often women don't recover from diastasis if they have a diastasis, because they just don't load the abdominal tissues enough. So we need to be less anxious about moving. You should be twisting, you should be turning, you should be reaching your arms up. I had one lady who for 12 weeks didn't lift her arms up for fear of separating her tummy more. And that's just poor advice from Dr. Google, basically. So we need women to be moving. Less fear around diastasis is really important. Diastasis, yes, it happens in 1/3 of women, but really, truly, as soon as you can get strength training with an instructor that can help you, or with a physio who can help guide you as well, that's really important. But no to binding.
Yeah,
sorry.
Yeah, absolutely. No, I think absolutely the same. And I always tell my clients, if we have an actual corset called the transverse abdominis, why don't we train it so it does the job of protecting your lower back, of wrapping you around, because that's the job at the end of the day. Why are we buying something and wearing it and letting the muscle just become dysfunctional? So, I mean, and it's not just that. Your postnatal Pilates is about, again, strengthening your back extensor muscles, strengthening your glutes and legs to, for example, squat and lift weights, carry the baby, rather than just hunching and rounding over. So it's for so many other reasons. It's just improving your posture. It's so important when you're breastfeeding and hunching over the baby for so long. And it's just for many more things than obviously just the belly. But I just want to clarify that, because I know that some women just pull out the corset and they say, oh, this will do it for me. No need of exercising.
Oh, if only. If only.
Yeah, we wish. Then our jobs wouldn't exist, maybe.
They wouldn't exist. But
Yeah.
you know, I think there is a lot of what you've got to think about, or women need to think about, is how much they're moving in the day anyway. You know, a lot of women will avoid squatting or lunging, but the reality is you probably are doing that from day 1 or 2 anyway, when you bend down to get the baby bag, or bend down to get those crazy heavy car seats. So if you don't load and rehabilitate your body, you're never going to be able to, your body's never going to be able to meet the demands that are placed on it. And then you get pain, and then you feel rubbish, and then you don't want to exercise. So it becomes this vicious cycle. So think of having a baby as you would any other injury. Hopefully, if you had major knee surgery, I'd like to think you had some rehab for it. You exercise that muscle back so that the knee's working beautifully. Same with your postpartum recovery. You need to give yourself time and allow yourself time to rehab. It's really important. It's just as important as you're nurturing your baby to nurture yourself. So it's essential.
Yeah, absolutely. Yeah. And so important as well that we do, that's prenatal training that we were mentioning before, because it's all starting from there. That's why we do so much leg strengthening, glute strengthening, and so on. Because if you are pregnant or later on you have a C-section, your belly is obviously very sore, it's achy, it's very weak. Using the muscle that can do the job when lifting, for example, the buggy or the baby from the floor and so on, it's just very useful because of how Pilates educates you to use those functional movements and do them properly so you don't get hurt. It's just such a big thing for women when they're in that situation. So yeah, absolutely. Getting to the end now, Emma, and what I'd like to say as we end is, in the book you'll get more information, more details of what we've spoken today. The book mentions something as well about perinatal mental health, which I find very interesting. We won't go into that today because we don't have the time. And it's a very big chunk of the book, in fact, because it's a very big part as well of women's situation when they get pregnant, and also during postpartum. Lots of emotions up and down, the mix of cocktails of sadness, happiness, crying. So a little bit of everything. So understanding your mental health and what's happening to your body is very important, so that you know you're not going crazy. It's normal. It's part of what's happening. So the book explains a lot of that. So I really encourage you that you get the book and read it and find out more about what we've been talking today. And about the book as well, we said, Emma and I agreed on just announcing a little thing that we had organized for everyone viewing us, as well for anyone who'll be watching this on recording, because I know most of my clients will be doing on recording as they're working at the moment, is that we're going to be doing a giveaway. So tomorrow I'll be announcing it, and then Emma will be sharing it as well, so that you all know and be able to participate as well. So we'll be giving away one of Emma's books and also 2 of my Pilates group classes. So if you want to come and train, it not necessarily has to be pre and postnatal. You can come as well to the normal classes if you're now a mum who's given birth long ago. But yeah, you'll have 2 Pilates classes and the book in the giveaway. So the lucky one will be taking both things. So they'll be able to learn more about the body and also exercise and take care after the body, which is, I think, a perfect pack for any woman in pregnancy, after pregnancy, and so on. So yeah, tomorrow I'll announce it then, Emma, and I'll let you know, so that you can watch out, everyone, and participate. And it will be active, by the way, until the end of May. So you'll have until the end of May to participate, and we'll remind you now and again so that you know it's happening and you can keep participating until then. And that's basically it, Emma. So if you want to finish by letting us know, where can people find you if they have any questions, if they want to get in touch, where can they contact you?
Yeah, so you can find me on Instagram, so I'm PhysioMumUK, or on come to me via my website, which is www.physiomum.co.uk. So yeah, thank you.
My pleasure. Fantastic. And the same for me. If you have any questions about pre and postnatal Pilates or normal Pilates, you have any questions about how I can help you, feel free to message me on Instagram. It's vivian.pilates, or you can go as well on vivianpilates.com and you can find information there on my website. I teach free classes every week as well on Instagram, which will be soon start to be done in YouTube. So you've got free classes there to try as well, slowly progress. But but obviously coming to group class is much better because then I can give you modifications, corrections, and so on. But you've got both there to try out. And yeah, just message us if you have any questions, any issues that you might be going through, and now you've just discovered that someone can help you. Feel free to get in touch. And thank you so much, Emma, for accepting to come to this talk today. Thank you so much for sharing all of that very valuable knowledge that you've got. And I hope that we stay in touch. I'll still recommend you to more of my clients for sure.
Likewise. Where are you? Are you in Weybridge?
I'm in Kingston. Yeah, southwest London.
Oh.
Yes, yeah.
Amazing.
So I teach in Weybridge.
Well, I'm in Guildford, so
yeah, not far away. Yeah, I teach in Weybridge sometimes. I teach in Weybridge in a studio twice a week, but then the rest of the days I'm here in Kingston from home teaching online for my online studio. Amazing. So we're not that far away. So I'm sure that we'll keep in touch. Yeah. So if you want to send any of your patients through to pre and postnatal Pilates, feel free, and I'll keep bombarding your name to my own clients.
Oh, amazing. I love that. Yes, I absolutely will. I will look forward to catching up with you soon then.
Fantastic. We'll see you soon then. Have a lovely rest of the day. And thank you everyone for joining us today and listening. Take care. Bye-bye, everyone. Bye.
Bye.